And the second part, I'll be concentrating on administrative aspects of the internship. In fourth one, I will discuss briefly about the professionalism. So those are the three main domains of my lecture. And first of all, we will go to the Sri Lankan health structure and health system. I'll discuss this in very brief way. This is a bit of a technical part. You don't need to remember as a introduction to what is a structure and what is the system. I'm giving this sort of introduction. Then the structure is basically how our tasks and responsibilities are allocated, coordinated, and supervised. As the lecture progress, I'll describe this in great detail, but it's basically how our activities, how the activities within the Ministry of Health are allocated and how they are coordinated, how they are supervised to achieve the organizational aim. That is the basic definition of a structure. And system is a collection of institutions, people, and activities, and the primary intention to promote, restore, and maintain health. In each of the, you don't need to remember. I just want to give an introduction to what is a structure and what is the system. Structure is how the tasks and responsibilities are allocated, coordinated, and supervised, and system is the collection of institutions, people, and activities. The primary intention of promoting and restoring and maintain health. So basically the administrative structure, the Sri Lankan health system is emerged from the constitution. The main thing that govern the structure is this with the decentralization. In 1987, there's a decentralization, and the 13th Amendment of the Constitution, which is the very famous sort of constitution in this country. The structure was decentralized. Now, existing structure is mainly based on this 13th Amendment of the Constitution in 1987. Accordingly, two structures were created. One is the central ministry structure and the provincial system of structure, provincial structure. Those are the two main structures that take place with this 1987 13th Amendment. Accordingly, the task, I told you the structure is how the tasks are allocated, coordinated, and supervised. So accordingly, there are certain activities that has to be done by the provincial council. Those are called provincial council list, and there are certain activities that should be done by the central ministry, or they are kept within the central ministry. That's why they are called reserved list. So provincial council activities, reserved activities that can only be done by the central ministry, and there is a concurrent list where both parties can engage in these kind of activities. In the provincial council list, the management of primary and secondary level hospitals and public health, the grassroots level institutions, management of grassroots level institutions, grassroots level public health institutions, primary and secondary hospitals are the main activity of the provincial council in relation to health. In relation to the central ministry or the reserved list, the professional occupations and training, for example, your universities are within the central educational ministry, and in teaching hospitals are vested. The management of teaching hospitals and higher level hospitals are the activity that is in the reserve list. So professional occupations, training are in the reserve list, and there are certain activities where both parties will do, like control of food and drug regulations, because there are certain elements that both parties can engage in. That is central ministry plus provincial ministry can engage in control on food and drug regulations. So those are the how the administrative structure was divided into central ministry and provincial system of administration, provincial and central. That's the main division in the health administrative structure or any other administrative structure in Sri Lanka. So with that, I'm going to do this one. We will see how the tasks and activities are allocated within the Central Ministry of Health system, how they are supervised, how they are coordinated, how they are allocated. So in this is the organization structure of the Central Ministry Health system. So in the top, there is a Honorable Minister of Health. He's the sort of a head of the our Central Ministry. Then the Secretary of Health. Then there are additional secretaries, additional secretary of medical services, additional secretary public health services, and these three elements, minister, secretary, and additional secretaries and senior assistant secretaries, these are composed of the Ministry of Health. This is the Ministry of Health, and down from here, this part is called Department of Health. So head of the department is the Director General of Health Services. This is the Ministry of Health, and one component of Ministry of Health is the Department of Health Services, and head of the department is the Director General of Health Services. Under him, there are several Deputy Director Generals of Health Services, what you call DDGs. For example, for you, your internship is giving internship. The task of giving internship is handled by Deputy Director General, Medical Services 1. Once you pass out, once you successfully completed your internship, that activity, the post-intern allocation is activity is coordinated by the Medical Services 2. So you will see different activities are allocated, supervised, and coordinated by different people. So they are under the department head of Director General of Health Services, there are Deputy Director General of Health Services, like Medical Services 1 and Medical Services 2. Under these Deputy Director General of Health Services, or DDGs, there are either directors of units of the programs of the Central Ministry, or there are certain curative healthcare institutions under the Central Ministry. Those directors will be there. So let's see what are the sort of directors of units of Central Ministry. Within the ministry, there are number of directors within the Central Ministry. That is Colombo. There's a Central Ministry of Health. So there is director planning, director information, like that. For example, your internship appointments is given by Director Tertiary Care Services. Your post-intern appointments will be given by Director Medical Services. Your personal file handling and your administrative matters are maintained by Director Administration Medical Services. So you will see the tasks are allocated to these directors. This is how the organization structure is separate. In addition, there are Director of Laboratory Services, Director Medical Supplies Division, and there are specialized campaign like TB campaign, leprosy campaign. Those campaign directors are there. Then Chief Epidemiologist, Director Maternal and Child Health, who is the Director of Family Health Bureau. So these are the directors of the units within the Central Ministry. In other than that, there are outside the Central Ministry, there are curative healthcare institutions, many curative healthcare institutions. Out of them, these teaching hospitals, specialized hospital, provincial general hospital, and district general hospitals are usually under most of the district general hospitals are under the Central Ministry. Teaching hospitals, specialized hospital is like Kapecha Hospital, National Hospital for Respiratory Diseases, Valisara. Those are the specialized hospitals. Then provincial general hospitals. So there are directors of those hospitals are managing the curative healthcare services under the Central Ministry, and there are very, very few base hospitals under the line ministry. There are medical superintendents, and those are also under the Central Ministry Health System. So I'll explain each of the differentiating characteristics of hospitals in coming slides, but at the moment, just simply remember that directors of teaching specialized provincial general and district general hospitals and some certain base hospitals under the line ministry are composed of this organization structure of the central ministry system. Then we come to the provincial health system. So in the provincial health system, although now the provincial councils are not activated at the moment due to non-held of the election and those things, but when they were functioning, the provincial minister of health and the provincial secretary of health was the head of the provincial health system. So now, although the provincial minister of health is no longer there, there is a provincial secretary, so he's doing the activities in relation to provincial health ministry. From that onwards comes the Department of Health, Provincial Department of Health. Head of the Provincial Department of Health is the Provincial Director of Health Services. So he's the head of the department, very similar to the central ministry. There's a head of the department for the Provincial Health Department, that is Provincial Director of Health Services. So there are 9 provinces in Sri Lanka. So there are 9 provincial directors of health services for each province. And under him, for each sort of district, there are regional and district director of health services. District or region, some people are called the regional director of health services. Now the new nomenclature may be the district director of health services. So we have sort of 25 districts in Sri Lanka, but we have 26 district directors of health services. Can someone put it in the chat box? Why is that? In very short period, can someone put why there are 26 district directors of health services despite having 25 districts in Sri Lanka? Do you know what the reason? Is there anybody who can explain this? Yes, let's see what is the answer. Yeah, Kalmune and Mampara, very good. Yeah, Kalmune, the Ampara administrative district is divided into 2 health districts, Kalmune and Ampara, very good. So under the provincial healthcare institutions, there is a district health office, and some institutions, like very similar to central ministry. There is a the regional director of health services office is there, and there are certain institutions under the provincial health system. So these are when you consider the health institutions, curative healthcare institutions in the provincial health institution, there are certain district general hospitals still under the provincial health system. So those directors are there. Then there are many of the base hospitals are under the provincial health system. The medical superintendents of those hospitals are there. There are specialized units, very corresponding to the central level. There are corresponding units within the provincial health system. Those are called like chest clinic, STD clinic, those things. There are medical officers in charge of those special units. So they are under the provincial health system. Then there are for the divisional hospitals, there are almost all the divisional hospitals are under the provincial health system. So divisional hospitals like district medical officers of those divisional hospitals are under the provincial council. Then there are primary medical care units. I will describe what are the differentiating factors of these institutions. Until then, the medical officers in charge on those primary medical care units, which is PMCUs, are also within the. So this is how the curative health tasks are coordinated, allocated, and supervised. So in the provincial health structure, this is how the curative healthcare activities are coordinated, allocated, and supervised. That is the structure I have told you in the beginning. So there are preventive healthcare institutions in the provincial health system, so provincial health structure. Like there are very similar. There are medical officers in charge of special units like district tuberculosis control officer, regional trainees, medical officer, regional training center, and regional malaria officer. So those are the people who are dealing with preventive health of those aspects. And there are MOH officers, medical officer of health officers also. That is how the preventive health structure is. Preventive health activities are coordinated. In addition to those institutions outside the this regional or district director office, there are certain there is a office very similar to Central Ministry of Health. There is a district director of health services office is there for the each district. So there may be administrative arm and a preventive arm. In administrative arm, there is a medical officer of planning. Then there is an accountant who is dealing with the financial things, an administrative officer who is dealing with those leave, the administrative matters in relation to district health office. And for the medical supplies, there is a chief pharmacist and other staff who is doing the medical supplies. So again, you will see the administrative aspect, how the administrative aspect in the provincial health structure is coordinated, divided, and allocated or supervised. This is how the administrative system. Then in the district health office, there is a preventive arm who is dealing with this medical officer, maternal and child health, regional epidemiologist, medical officer non-communicable diseases, regional dental surgeon, food and drug inspectors, health education officers, and public health inspectors. So these people are handling the activities in relation to preventive health in the district health office. So medical officer, maternal and child health, as you see, the name knows, name denote, it will handle the maternal and child health aspect, family planning, those things, and family planning, antenatal care, postnatal care, child health, those things. The regional epidemiologist will handle the communicable disease aspect. Medical officer, non-communicable disease is handling the NCD preventive aspects. So all these preventive aspects are coordinated, allocated, and supervised in the district health system according like this. So this is how the organization structure of the central ministry level and the provincial ministry level. This is how things are, the activities are coordinated, allocated, and supervised. So at the same time, there is a, at the institution level, at the ground level, institutional level, curative institution level, there is an organization structure as well. For example, in the institutional level, this is how the tasks are supervised and allocated and coordinated. The head of the of institution may be the director or a medical superintendent, and in his absence, deputy director or deputy medical superintendent will look after the duty. And the medical services arm is handled by this either consultant or a medical officer in charge. For example, you see the in OPD, there is a medical officer in charge who is handling the medical officer's matters, and the consultant will be the ward during his under his supervision. There may be under his supervision, there may be SHO, senior house officers, and medical officers will be there, and under them you will be posted as intern. So this is how the doctors' affairs are handled. Consultant or medical officer in charge, then the SHOs and MOs and interns. And for the nursing services, this is the nursing services arm. The head of that arm is the special grade nursing officer. You may have seen the people who are wearing blue uniform. Those are the people called matron, or the special grade nursing officer is the technical term. So under the matron, there is a sisters of unit, sisters in the wards, or sisters in charge of units, those who wearing white uniform. And then under them, there are nursing officers and midwives. So nursing officers you may have seen during your medical school, the nursing officers and midwives. So this is how the organization structure within the nursing services. Then this arm is called professional supplementary to medicine. Professional supplementary to medicine. There are seven categories in this professional supplementary to medicine in Sri Lanka. Those are medical laboratory technologists, radiographers, physiotherapists, pharmacists. Dispensers are not belong to this category, but MLT, radiographers, physiotherapists, pharmacists, and other ones are occupational therapists, speech therapists. So those are the 6 categories that belongs to professional supplementary to medicine. Dispensers are belong to paramedical category. But they are supervised by the chief pharmacist. So that's why I put it here. Their supervision is done by chief pharmacist. So there may be chief physiotherapists, chief radiographers, chief MLT, like that. There are chief PSM officer will be there, and under them there is the PSM services. Except for dispensers. Dispensers are belong to paramedical category, but they are supervised by the chief pharmacist. That's why I put it here. Then there are category called chief paramedical officers. Chief paramedical officers. Then for this category, there are EEG technicians, then ECG technicians or cardiographers, then ophthalmic technologists, then PHI, PHM. Again, although midwives are supervised by the matron, they are actually the paramedical category, but this is how the paramedical category is. Their activities are allocated or supervised. So this is the sort of a clinical categories that within working in the hospitals, and this is the sort of a the right-sided half belongs to the administrative arm of the hospital, right? The operational arm. This is the technical arm. This is the sort of operational arm of the hospital. So in that, there are administrative officer under the office. In the office of the hospital, there is an administrative officer. And then under the administrative officer, there is a chief health management assistant, or what do you call CCO, chief clerk. Under him, there are health management assistant. This is the clerical staff, right? Clerical sort of group. Then under the administrative officer, there are semi-skilled and skilled officers, what you call primary skilled and primarily unskilled officers are there, like drivers, telephone operators. There are a variety of categories under that. So these under the administrative officer, these people are there. Those are called primary, semi-skilled or skilled category. Then the administrative officer is responsible for your administrative matters, human resource matters, the leave, disciplinary procedures, all those things are the administrative matters handled by the administrative officer. The accountant is handling the financial matters of the hospital. Under him, there is a chief health management assistant, and there are under chief health management assistant, there are storekeepers and health management assistant. This is the financial clerking system. In addition to that, there are supportive staff. Head of the supportive staff is the overseer, but he's overlooked by the administrative officer. And under the overseer, there are attendants and health assistants. Those are primary. Attendants are primary skilled staff, and at health assistant are primary level unskilled staff. So this is how at the institution level, tasks are allocated, coordinated and supervised. This is how the organization structure within the institution. Then if you have any questions, you can put to the chat box. If not, I'm going to do the administrative system. Right? Administrative system. So we will discuss about the administrative system now. If you have no questions regarding organization structure of the Ministry of Health or the health services in Sri Lanka. So administrative system, I told you that it's a collection of institution, people and activities. Institution, people and activities. There are two main arms in the Sri Lankan administrative system, two categories of institutions and working people and activities, that is called curative and preventive. Right? So curative activities and preventive activities. That is how the administrative system is divided into in Sri Lankan health system. So these are the curative institutions in Sri Lanka, categories of curative institutions in Sri Lanka. the highest level institution is the National Hospital or the National of Sri Lanka in Colombo or National Hospital Kandy. So it has the maximum number of specialties. Maximum number of specialties are there. Depending on the specialty, up to the base hospitals are categorized. Up to base hospitals, the hospitals are categorized according to the specialties available in those institutions. So National Hospital of Sri Lanka and National Hospital Kandy has the maximum number of specialties. Then there are teaching hospitals. Usually teaching hospitals are affiliated to a medical faculty. For example, you see the newest teaching hospitals in Sri Lanka, the Ratnapura and Anuradhapura, and also I don't know whether Kuliyapitiya or the Kurunagala is a teaching hospital. Both are affiliated with the affiliation to the Wayamba Medical Faculty, then Sabaragamuwa Medical Faculty and Rajarata Medical Faculty, they became teaching hospitals. So teaching hospital is a thing, hospitals that affiliated to a medical faculty in Sri Lanka. So other than that, there is one category I missed here, the specialized hospitals. Specialized hospitals are the where the specialized services are provided. For example, Apeksha Hospital. Apeksha Hospital is the caring for the cancer patients. Then National Hospital for Respiratory Diseases in Balisara, it caters for the respiratory special cases of respiratory diseases. Then National Institute of Mental Health, the psychiatric patients, is located in Nangoda. So the I missed here is the specialized hospital. So specialized hospital come after the teaching hospitals. So it caters to the specialized curative patients. Then there are provincial general hospitals. Provincial general hospitals. Usually one province will have a provincial general hospitals. Each province will have provincial general hospital. For example, now only because almost all the provincial general hospitals have affiliated with the medical faculty, the only single provincial general hospital is there in Sri Lanka. Can you name the what is the provincial general hospital? Only provincial general hospital now in Sri Lanka. Can you tell me the Badulla? Yes, very good, very good. Yes, Badulla is the only provincial general hospital, but with the establishment of Vellassa Medical Faculty, it will be converted to a teaching hospital. Then there will be no more provincial general hospitals in Sri Lanka. So very good. Then for each sort of district have a district general hospital like Polonnaruwa, Monaragala, Matale. Out of those district general hospital, Matale may be the one district general hospital affiliated to the with the provincial health system. No, Mana, Mullaitivu, Vavuniya, those three district general hospitals, Kilinochchi, are lying with the provincial health system. Matale also, and then Gampaha and Nigambu district general hospitals are also affiliated to the provincial health system. Other than that, most of the district general hospitals are now with the line ministry. For example, Matara, Hambantota, then in Kalutara, then for the Gampaha district, there are two district general hospitals, Nigambu and Gampaha. Then for Puttalam district, Chilau. Then like that, there are district general hospitals in each of the districts in Sri Lanka. Then then it comes to the next lower level institution is the base hospitals. Base hospitals are the lowest level of health institution where medical specialists are working. It's the lowest level of healthcare institution where consultants are there. Below base hospital, there are no consultants or medical specialists. So base hospitals have at least basic minimum specialities. Base hospital B will have must have like Gynaecology, pediatrics, medicine and surgery, and anesthesia usually, and sometimes there may be radiologist, sometimes base hospital. Though the lowest level of institution where consultants are available are the base hospital. Below base hospital, there are no consultants. So below base hospital, there are what we call divisional hospitals. They are categorized into type A, type B, and type C. Divisional hospitals are the lowest level healthcare institution where inward facilities are available. Below base divisional hospital, there are no inward facilities. These are categorized into type A, type B, and type C depending on the number of beds. Type A has more than 100 beds, type B 50 to 100 beds, and type C less than 50 beds. So that's how divisional hospitals are categorized. And below base hospital, below divisional hospitals, there are primary medical care units. Only ambulatory care is provided in primary medical care units. There are no inward patients. Only either OPD or ETU will be there. But basically, it's a sort of ambulatory care facilities, ambulatory curative care facilities are given, OPD or a ETU, when they manage and transfer a patient to the higher level institution. So that's how the curative system is organized in Sri Lanka. Then there is a preventive system. Preventive system, there are at the central level, there are specialized campaigns like Family Health Bureau, Epidemiology Unit, then TB control program, leprosy control program, malaria control program. So as such, there are specialized campaigns in the central level. Then there are vertical programs at the regional or district level corresponding to the specialized campaign. For example, Family Health Bureau activities are represented by medical officer, maternal and child health. Epidemiology unit work is represented by the chief epidemiology unit activities is represented in the district level by the regional epidemiologist. Then in the TB control program, at the district level, district DTCO, district tuberculosis control officer. So he will represent the regional or district level. Then malaria campaign, regional malaria officer. Then medical officer leprosy, who will at the district level, and he is the one who representing the central leprosy campaign. So like that, there are regional or district level vertical campaigns are there for the preventive health system, and the grassroots level preventive health structure is the medical officer of health division or MOH division. So that is how we will discuss about the MOH office, medical officer of health division, in the next coming slide. So this is for the statistical purposes. I am giving you this data. So this is how there are 2 national hospitals, 9 teaching hospitals. This is according to 2020, but these may have changed now. This teaching hospital 9. I think there are now 10 teaching hospitals, and a provincial general hospital reduced to 1. So specialized teaching hospital 6, other specialized hospital 9, district general hospitals 11, type B, like that. There are this is the line ministry, and this is the provincial. So this is how the list is goes on, right? This is thus for the statistical purposes I am putting it. Then the preventive system in the central level, I'm not now going to describe details about the preventive health system very quickly. In the central level, there are 2 deputy director generals, public health services 1 and public health services 2. So under the public health services 1, all the disease control program, communicable disease control programs are there, like epidemiology unit, occupational health and safety, STD/AIDS, TB campaign, malaria, filaria, and leprosy campaign, public health veterinary services, dengue, and CKDU. So mainly the Deputy Director General Public Health Services 1 section deals with the diseases, communicable diseases, except for this chronic kidney disease unit. And then the Public Health Services 2 mainly deals with the other aspect, mainly maternal and child health, health education, nutrition, public health nursing, state and urban health, youth, elderly, and disabled. So those are the matters discussed under the public health services too. So basically, this is how at the central level, provincial health system, preventive health system is divided. Then at the MOH level, uh, this is other than district level vertical campaigns, the grassroots level preventive health structure is the preventive health institution is the medical officer of health. So there are approximately about 353 medical MOH divisions in Sri Lanka. They were almost the area demarcated is almost similar to district that is divisional secretariat. Very similar to divisional secretariat. The demarcation of the area. There are 353 MOH divisions. Average population is about 60,000 under their care, and in addition, there are NCD healthy lifestyle centers are also not under the MOH office, but in the hospitals, there are 922 healthy lifestyle centers are there. So we'll see what are the responsibilities or activities of the MOH office. At the grassroots level, they are responsible for maternal and child health, like antenatal care, postnatal care, immunization, and reproductive health, that's family planning. So those things are the responsibilities. And this maternal and child health and reproductive health is managed by the public health nursing sisters, midwives, and those people. So that is the this maternal and child health and family planning is handled by public health nursing sisters, public health midwives, that category. Then there's another activity, they are controlling of communicable diseases, implementation of food act, and water and sanitation. So those three arms are conducted by the public health inspectors. So these are the three areas that deals with the public health inspectors. Then in addition to that, there are adolescent dental clinics and school dental clinics. The school dental therapists and dental surgeons are there. These people are handling the oral health activities. And there are field officers for malaria and filaria campaigns who are dealing with the what we call public health field officers. They are dealing with the malaria and filaria control program. So this is how the MOH level system is organized. Then this is the organization structure of the MOH office. Higher level is the MOH, Medical Officer of Health. Then there is Assistant Medical Officer of Health. As I told you, the nursing arm for the family planning, reproductive health, and maternal and child health arm is there. Public health nursing sister, supervising public health midwives, and field public health midwives. Then there's a control of communicable diseases and water and food sanitation. These things are handled by public health inspector and trained public health inspectors. So those are the people. Then oral health, dental surgeons, and the school dental therapists. Then at the MOH office, this is the MOH office area. There's a chief health management assistant and health management assistant. Then, the public health field officers again are working in the field, like they are handling the malaria and filaria campaign activities. And then there are drivers and assistants. This is how the organization structure of the MOH is organized. So next, this is the what I have to tell you about the organization structure and the system of the Sri Lankan Health Ministry. If you have any questions, you can ask now, or I will go to the second section of my session. If you have any questions, I can give you about 2 minutes. If you have anything, if you want to ask, put it to the chat box. I can give you now in Australia, it's 2:14. I can give you about 2 minutes, 22 minutes. If you have any questions, before I can go to the next section, you can ask any question regarding that matter. So basically, what I want to tell you is that the structure is how the activities are, the tasks and responsibilities are allocated, coordinated, and supervised. So in the administrative structure of the Sri Lankan Health Ministry, it is governed by the 13th Amendment of the Constitution. Accordingly, there are line ministry activities, reserved list, provincial council list, and the concurrent list. And accordingly, there are provincial health system, provincial health structure, and the provincial health structure, and the central ministry health structure. I told you what is the organization structure of each of these provincial and line ministry. And I talked about the what you call the system. System is what are the activities, people and actions, people and institutions, collection of those things. So we talked about the curative health system and the preventive health system. In the curative health system, I told you that the highest level is the national hospitals, then teaching hospitals, specialized hospitals, provincial general hospitals, district general hospitals, base hospitals. Up to that level, only the consultants are available. Then the divisional hospitals, where the in-ward facilities are there. Then the primary medical care units, only the outpatients or the ambulatory care is provided. In the preventive health system, there is a specialized campaigns like Family Health Bureau, Epidemiology Unit, TB campaign, malaria campaign. And at the district level, there is a regional or district level campaigns corresponding to the central level and the grassroots level MOH office. Then I discuss about how the organization structure and activities of the preventive health structure and the system in Sri Lanka. At the DDG level, there is certain activities are allocated like that. The diseases and the other Family Health Bureau, those maternal and child health parts. And then the MOH office, how the activities are coordinated. So I hope that is clear to you. So I'll go to the next section of my presentation. So here, this is, I think, the most important part for you, I think, as an pre-intern. So I'm just going to discuss about the administrative perspectives of the internship. So basically, my lecture will be like this: rules and regulations of the internship, disciplinary matters, leave during internship, confirmation and promotions, and administrative perspective of internship, which is what administrator you can provide to the administrator. What sort of assistance support you can provide it to the administrators of a hospital. So we will go to the rules and regulations. So basically, the internship is defined, or internship is recognized by the Sri Lanka Medical Council as the continuation of the medical education program of a medical practitioner, as mentioned in the first sentence, the guidelines to internship. So it is a part of your medical education program which you have learned in the medical school, medical faculty. So it's a continuation of medical education program for medical practitioner. So whatever the leave you are taking, it's leave say that leave is a privilege or not a right, may curtailed or cancelled at any time by the authority granting the leave. That is the leave, what is called the establishment code mentioned about the leave. Leave is a privilege and not a right. So during the internship, the leave is can be considered as a lost opportunity to learn. So this make sure that you see internship as a continuation of whatever the education program of becoming a medical officer. So how this works? So Sri Lanka Medical Council referred this as a pre-registration appointment. So I'm now going to tell you how you are with the internship, how you are going to link from a medical student to a medical practitioner. How you are a medical student and you are going to become a medical practitioner with full registration once you complete your internship. So Sri Lanka Medical Council mentioned this as a pre-registration appointment. prior to registration. This is sort of a continuation of your medical education program. So you will be registered in Sri Lanka Medical Council under Section 32. You will be given a provisional registration. So with the Section 32, the provincial registration, you can only be employed in a government hospital. Can only be employed in a government hospital. You can only issue the medical certificates under the name of the institution or the consultant. You can use the title of a doctor, and you can recover reasonable an allowance or a salary. So that is how, though it's not a salary, it's an allowance. What you are being paid is an allowance, so not a salary. So you are still not a government, fully privileged government servant. So you will be with the pre-registration appointment, you will be registered provisionally under the Section 32 of the Medical Ordinance. So after successful completion of the internship, you will gain the full registration in Sri Lanka Medical Council. You will gain the full registration. So earlier you could only employ it in a government hospital. Now you can practice medicine and surgery in anywhere in Sri Lanka. So that's again a difference. Earlier you were only paid an allowance. Now you can demand and recover reasonable charges for your activities. Earlier you can only issue medical certificates under the name of the consultant or the institution. Now you can use medical certificates under your own name. And similarly, you can use the title of a doctor, and you had certain other privileges with becoming the full registration. You qualify to sign certain documents for like banks, passport application. So you are now recognized as a professional in Sri Lanka. Expert in the field in codes in relation to diseases, injuries, and at the same time you can store and prescribe narcotics. So this is the difference between becoming an intern to a fully pledged medical officer with Section 29 of full registration of Sri Lanka Medical Ordinance. So you can see there are certain privileges you will miss during the internship, like doing private practice, because we could only employ it and work in a government hospital. So you can't do private practice because of that. It's a violation of law. Right? So that's why you can't be practicing, you can't do private practice during the internship. It's prohibited by law itself, right? So this is how how you are with the internship. This is how with the internship you are linked to the full registration with the Sri Lanka Medical Council. This is how it happened. And let's see certain other rules and regulations of the internship. Internship is a training attachment and allowance is paid. As Sri Lanka Medical Council mentioned, it's a continuation of the learning process of medical practitioner. It's a part of your medical school education. Intern is under the administrative control of the head of the institution. Intern is under the disciplinary control of Sri Lanka Medical Council and must be abide by the government and specific institutional regulation like e-code, financial regulations, circulars, etc. One advantage of becoming intern is all the other government servant has to pay for their residential facilities. But for interns, residential facilities will be provided free of charge for the duration of the internship. So that is one advantage of becoming intern. The responsibility of inventories within the residential facilities is with the interns. As I've told you, because you are not legally entitled to practice medicine and surgery in Sri Lanka, you are only entitled to do work in a government institution. You should not be engaged in private practice. And you may mute your mic, please. Please mute your mic. I don't know who is speaking, but please mute your mic. Then another important aspect should be present promptly when requested by ward sister. Should not manage or give instructions by phone. It's a very important thing. important thing regarding the internship should be present promptly when requested by ward sister or a nurse. Should not manage or give instructions by phone. And this one should wear a white overcoat, whatever the white, whether you are not wearing white. This is mentioned in the guidelines of the internship. Whether you are wearing white coat or not, you should be properly dressed, suited to a medical professional. So that's the basic information that should be given. There are a few questions. Yes, mute your mic. Yes. Any other thing? No. So those are the few things. Then this is how the guidance, supervision, and control. The you will be technically you will be with you will be supervised by three people, three arms. Technically, you will be supervised by the assigned medical consultants and the senior colleagues. That's a technical part. And disciplinary, Sri Lanka Medical Council. Usually, the Sri Lanka Medical Council is the disciplinary authority of interns, but when you become a fully privileged medical officer, the disciplinary authority transferred to the administrative or Ministry of Health. And administratively, you will the head of the institution where your internship is doing will be the administrative supervision. So you will be under the three domains of guidance, supervision, and control: technically, administratively, and disciplinary. Please remember this aspect when you are commencing your internship. Right. So the few other regulations should maintain a diary. I will discuss about the importance when it comes to disciplinary matters. Should maintain a diary. A diary should be endorsed by the consultant at the head of the institution at the end of every month. So your diary should be signed by the consultant at the end of the institution at the end of every month. Should be physically present between 8 to 12 and 12 to noon and 2 to 4. And the rest of the time, you should be on call to the unit. Whenever the telephone call is given, you should be going to your ward to do your duties. Weekend off from 12 noon Saturday to 8 a.m. Monday. But important thing, should be ready to present the cases to the consultant on Monday morning. And at the same time, every other weekend is off, usually. Should have a reasonable cover-up of your duties in the unit with your co-house officers during the weekend. So if you have two house officers for the ward, one will be on call and the other person can have the weekend off. So without reasonable cover-up, you must not take the weekend off. It's a very important regarding the leave. Any leave should be, you should have a cover up your duties. So you can't just leave your ward thinking that other person will look after that. You have to be ensure and you have to be verify whether your other house officer is working for the weekend, and then you can take the weekend off from 12 noon to 8 a.m. Monday morning, but should be ready to present the cases to the consultants in the Monday morning. Then if any case the internship period is extended, the intern is not entitled to any allowances. We have seen that happen to during my tenure. I have seen about 2 or 3 people getting the internship terminated due to various reasons or extended. And if it is extended, intern is not entitled to any of the allowances for that period. So that keep that in mind. There are various issues that coming up. It's a little bit of a sort of a stressful period, although most of the people are enjoying it, but still make sure you behave professionally, behave ethically, behave with your other team members in the team, a very cordial relationship, maintain very cordial relationship, unless it will be a very stressful period. And for most of our people, it will be a very enjoyable period. if you maintain cordial relationship with your team, so make sure that you do that. So for any reason, if your internship is extended, you are not, and there are heaps of repercussions of extending the internship. You will be not, you will lose your seniority within your batch. So there are heaps of repercussions of extending the internship period. So these are some of the last year last year circular on intern medical officers. So you will see key things I have mentioned here. Their internship rules and private practice. Their internship will be terminated if their work and conduct during this period found to be unsatisfactory. They will be required to abide by the regulations of the establishment code, financial regulations, departmental rules and regulations of the government, and note of the Department of Health Services that may be issued time to time. Private practice in any form is strictly prohibited for the intern medical officers. So rules and private practice in relation to that. Then leave. Intern medical officers are not entitled to any paid leave. Leave is restricted to 14 days, of which not more than 2 days should be taken at a time, except in the case of illness. If leave is more than 14 days, extra leave period of the relevant appointment must be repeated. I'll describe it in great detail when it comes to the leave. However, any leave should be covered by a medical certificate approved by the Ministry of Health. If for any reason the period of internship is extended, that intern is not entitled to any emoluments during that period. Allowance and accommodation. This is the circular in relation to allowance and accommodation. They should be provided with accommodation free of charge. So another important thing is the overcoat is there, everything is there. So I have mentioned whatever the things in this circular in the previous slides. And also there are a few books issued by the Sri Lanka Medical Council. I think you will be getting them with the commencement of internship, and when you are registered provisionally with the Sri Lanka Medical Council, go through these books very carefully, because they are giving some important guidelines for you to properly perform during your internship. Then some of the other things, privileges of government employee or government probationary period will not be granted. So example, leave and salary and extra duty. So there won't be any paid leave for you. So if you are taking more than 14 days and there's a salary, you are not paid the salary and you are not getting the extra duty for working extra hours. Leave only 14 days per year with maximum 2 in a single instance, except in case of illness, it should be covered by a medical certificate. Extra duty, physically present between 8 to 12 and 12 to 4. Outside these times, on call for the unit, but you are not paid any extra duty allowances. But there may be other privileges like training lead to a full registration with a paid allowance. You will be paid an allowance and you will get a training free of charge, and you will end up in full registration with a license to practice medicine in Sri Lanka, medicine and surgery in Sri Lanka. That's the linkage between your medical career and the becoming a professional medical practitioner. So this link is provided by the internship. Then residential facilities will be given without any payments. So this is the allowance circular. This may have changed, but I think it's same. Their training allowance will be paid as any other trainees within the Ministry of Health. You will also considered as a trainee for this period. The residential facilities, principal residential facilities will be provided free of charge to all intern medical officers. This is one of the main requirements considered by the Sri Lanka Medical Council when selecting a hospital for internship. Therefore, there must be residential facilities allocated for interns in any hospital, but there are inadvertent incidents. In such case, it will be case-by-case basis decided by the head of the institution and may arrange a temporary measure. So Yeah, I have seen few inadvertent incidents. In that case, case by case basis, something will be arranged by the head of the institution. Some temporary measures will be arranged. So private practice during internship, it is not entitled since you are provisionally registered with the Sri Lanka Medical Council. Therefore, you are only entitled to practice within a government institution under the supervision of a consultant. So if you do that, it's a violation of medical ordinance or the law of the country. So disciplinary matters, I will go into the briefly into the disciplinary matters of the most of these disciplinary matters are not for the interns, because these are disciplinary matters for the medical officers. Once you become full registered and become a government medical officer, then these disciplinary matters will be important to you. But your disciplinary authority is the Sri Lanka Medical Council. But I am going to highlight some of the important disciplinary matters for you, because mainly the diary maintenance, because that is the most frequent case of disciplinary matter for medical officers, which I have seen in my uh, tenure in Ministry of Health. So the disciplinary matters, the only matter here is the internship will be terminated if their work and conduct during this period found unsatisfactory. So you will be required to abide by the regulations of the establishment code, financial regulations, departmental rules and regulations, regulations of the government, and orders of the Department of Health Services that may issue time to time. So this is the main the extract of the letter in relation to disciplinary matters. But the one of the commonest method of entangling with a disciplinary inquiry for a medical officer is with the maintenance of a diary most of the time. So you should maintain it daily, even if there is urgent work. Even after that urgent work, you should maintain it daily. Diary must be kept in accessible place to the head of the institution and must be submitted to the head of the institution on first day of every month, and must keep two diaries. That is because when one diary is with the head of the institution for his endorsement, you should maintain the other diary until you receive the first diary. So you must keep two diaries and must submit to the head of the institution on first day of every month. So this is the extract of a diary of a medical officer. One thing, yeah, the date should be there. Place, details of work and on-call duties. You must mention those things in the second column. Third column, arrival time. Fourth column, departure. Fifth column, hours of work. Sixth is the signature. So these are the components of a diary. So you need to keep two diaries, submit to the head of the institution first day of every month, and kept in an accessible place for the head of the institution. This is the circular in relation to the diary maintenance. You will see all those things mentioned here. For example, daily entries should be done even if it is urgent work. All medical officers and dental surgeons are required to maintain diary. Notes should be made daily. Required to following notes, date, time, report for duty, time go off, on call duty, everything should be mentioned there. In the case of medical officer is called for an emergency, he may enter the time reported for duty in the diary after engaging in the urgent work. All entries in the diary should be initiated by the officer who is maintaining the diary at the time of he makes the notes. So that is in relation to maintenance of diary. Diary should be kept in an accessible place where any officer can be inspected, to be kept in an accessible place. So that is this word. Submit to the head of the institution first working day of every month. And the head of the institution should endorse the diary. Then two diaries should be maintained so that he could make every other month separately. Two diaries should be maintained as to enable the officer to make notes definitely in one diary, while the other one submitted to the office for checking. So two diaries is an important factor. Disciplinary action is taken against officers who do not comply with the instructions given in the circular. It's the most frequent, most common thing to entangle with a disciplinary action in the Ministry of Health. So be careful, even as an intern officer. Make sure to you adhere to the contents of this circular. So these are some of the example. Not maintaining 2 diaries. That is the reason for this disciplinary procedure, initiation of disciplinary procedure, that not maintaining 2 diaries. Then, yeah, this is the same thing. Not maintaining 2 diaries, and then this one, yeah, this one not putting diary in an accessible place. I'm sorry, these are in Sinhala, yet I'm telling you the content of this disciplinary inquiry, that not providing a place for, or accessible place for keeping the diaries, not providing a space. Then this one again, this is a post-intern one, not related to you. Right? These are not very much in relation to internship. This is one of the extension of, yeah, this previous one is the extension. What he said, that delay in internship, delay in completion of internship by 1 year. So it's a very, very, very grave incidents. And then this one you can see Simavasika Vaidya something, and not at prompt attending to the patient, and ultimately initiating a preliminary investigation, and ultimately entangling into a so you shouldn't managing patients from the phone, and you should attend promptly to the patient once you summon. This one is that රෝගියා පැය 5කට ආසන්න කාලයක් ගත වුණතුරු පරීක්ෂා කිරීමකින් හා ප්‍රතිපාර ආරම්භ කිරීමකින් තොරව නොසැලකිලිමත් අයුරින් හා වගකීමකින් තොරව කටයුතු කර ඇති බවට. So again for an intern medical officer. So this is initiation of that. I can't remember what has happened to this thing, but so don't get entangled into a disciplinary inquiry, because it's a grave consequences. That's what I am going to tell you here, because these are the consequences. So once there is an initiation of a disciplinary inquiry, you will deprived of all the privileges until investigation is over. If there is a punishment, then you are deprivation of a satisfactory service, which leads to no promotion for 5 years and no car permit for 5 years. Although now the car permit is of not any use because car permit is not given, but there will be no promotion for 5 years. And so you are deprived of all the deprivation of all the satisfactory services, so you will be not promoted. So think about those things. And more than that, the main thing is the mental stress undergoing during that investigation until this investigation is over. It's a huge stress. I have seen people crying in front of myself even. It's a very pathetic situation. So main thing is to prevent that kind of entangling into a disciplinary process, and because it's a very, very sad situation. Even sometimes as administrators, we are also helpless. It's a very, very grave, stressful situation. So my only advice is prevent from getting disciplinary inquiry or getting a punishment for that matter, and do your job properly. Few basic things for the intern. Just maintain your diary properly, and when summoned for a patient when asked for a patient to manage, just promptly attend there at least. That in that case, for 5 hours, that intern haven't examined the patient. So it's not appropriate at all. So try to, I mean, you may have work, but still at least some sort of attention, not clerking, but some sort of attention can be given. That's the art of doing internship. I will tell you in coming slides as well. So don't entangle with the disciplinary inquiry. As much as possible, try to prevent those things. Right? Yeah, then this is the process. I don't want to go into detail. These are also not very much important regarding what are the punishments, what are the activities the spell out in the establishment code. Just read them once I provide you with the slides. This is what are the spell out in the establishment code regarding offences. Right? So one few important things for schedule of offences. I think the sixth one, use or be in possession of narcotic drugs, misappropriate or cause misappropriate public funds, or alter, distort, destroy or fuse state documents. Even if you do it for the BHT, if you do that, it's considered as offense. Refuse to carry out lawful orders given by senior officer or in subordination. So those are the few things that I want to highlight, but it's not very much important. This one, being drunk or smelling liquor within the duty hours or within government premises. So those 5, then 7, then 12, and 14. So those things are important offenses. So whatever the thing, whatever, please remember that don't entangle with the disciplinary inquiry throughout your career, not as an intern, but throughout your career, because it's a very stressful period. That's the main message I just want to give you this year. So leave during internship. So in any leave, arrangement for cover-up and approval from the immediate supervisor and the head of the institution is a must. So you must arrange a cover-up, and for the cover-up, you must get the cover-up and the leave. You must get the approval of the consultant and the head of the institution. So that is the leave during, main thing about the leave during internship or any other matter, any other time. Total 14 days during the year, 2 days per month except an illness. In an illness should be covered by a medical certificate approved by the Sri Lanka Medical Council. Maximum of 2 days in a single instance. I am repeating these things because this is important. Any leave for more than 14 days within the relevant appointment must be repeated in full. So remember this one. Any leave more than 14 days within the relevant appointment must be repeated in full. So important leave is the maternity leave. So this is the most important thing I want to highlight for the ladies. Minimum period to 28 days. You should not report to duty before 28 days. If you become pregnant, or if you deliver a baby, you have to take at least 28 days according to the law of the country. So you should not report to the duty of 28 days. That means that you are taking leave for more than the recommended period for the internship. It is 14 days more than the recommended period. So maternity leave period minus 14 days is extended. Right? If approved merit no change, if you get the approval for the maternity leave, your merit for the post-intern appointment will not change. But I must tell you, your seniority will be loosened. Right? One other thing about the maternity leave is that three parties are suffering due to, if you are taking a maternity leave, you will see that 3 parties are suffering. One is your baby. That is very sad. It's a very stressful period for the baby to be born. So postpone your maternity leave. You are responsible adults. Postpone your maternity leave until your internship, because it's a very, considering the stressful period, it's a grave repercussion for the baby as well. Then one other is your co-HO. He or she won't get another house officer, companion house officer for the rest of the period. So he will have to do double the work during your maternity leave period. So that is again a grave consequences. And the third one is the health system. So ultimately, system will suffer a lot because there is no intern. Patients and hospital will suffer. So even if you ignore the system and your co-HO, your baby is the most important person. So try to postpone the maternity leave. I'm not, I may, it's not, it may not, it may be unethical to tell you this, but think about as a professional, responsible adult, whether you should get pregnant or get maternity leave during the internship now itself, right? So I'll tell you the scenario, what will happen. So this is the internship, right? Say that 1, 2, 3, 4, 5, 6, 7, 8, up to 12 months. So the maternity leave, say that you are doing the medicine appointment, and once you completed 2 months, you had you went for the maternity leave, right? 3, 4, and 5th month you are on maternity leave. Now, when you come back, you will complete the 6th month in the medical ward, and then you start the surgical appointment for the 7th, 8th, 9th, 10th, 11th, and 12th month. This is a surgical appointment. Then you have to repeat this 3 months after your internship. That is 13, 14 months of maternity leave, 3 months plus 14 days, you have to do the medical appointment. This is the 5 weeks you have to do the medical appointment. So your internship completion date is 14 and a half weeks. 14 and a half weeks, your internship completion date. Now, this will affect the Sri Lanka Medical Council registration date. You will be registered with the Sri Lanka Medical Council at the middle of the 15th month. So you will be, because of that, you will be judgment. This definitely will happen because your full registration of the internship is considered as the preliminary grade appointment date. You will be in the preliminary grade appointment date will be delayed. Your merit will not be changed. Your merit won't be changed, but so post intern appointment there will be no effect. But for the rest of the career, you will be junior among your batchmates. So think about this thing as well. So this, because your preliminary date appointment date will be extended. Right? I know there will be a lot of questions. Can intern as a father take at least 1 or 2? Yes, paternity leave is 3 days no. So it is within that. It is within 14 days. Right? It is within 14 days you can get 2 to 3 days leave, paternity leave. You can get that, but make sure in any leave, arrangement for a cover up and approval from the consultant is a must. You have properly Can you see the screen and the slides?
Not yet, sir. Okay. It's coming up.
I think I have lost the connection, it seems. Now it's okay. Prashant, is it okay?
Now can see, need to make it full screen.
Okay. Now,
Full screen, sir.
now, okay. Now,
So can we close this presentation and restart again? Full screen, sir. Yeah.
Now, okay.
Yes, yes.
Okay. So this is what I want to. Sorry for that technical issue. So if you have any question, just put to the chat box. I'm going to continue from here. Right. This is not very much important regarding the leave after the internship. We will may do it during the post-intern thing. So please remember regarding the maternity leave and the any leave, the arrangement of cover up and approval from the consultant and the head of the institution is a must. Please remember that one regarding the maternity leave. Yeah. So leave before and after internship, prior to obtaining leave, except in medical leave, arrangement for cover up is a must. Should maintain the contactability, should be informed and requested from superiors, should be approved from the supervisors. Approving officer has the right to cancel the leave at any moment and need to fill relevant application forms when you are requesting the leave. General 125 leave spent in Sri Lanka, General 126 leave spent in foreign country. So then is there anything you want to ask regarding the leave? If not, I will go to the confirmation and the promotions. This one, yeah. So after the internship, you will be promoted to the preliminary grade, then grade 2, grade 1. Either you can go to administrative grade or the specialist grade. If you go to the administrative grade, you will go to the deputy administrative grade, senior administrative grade, DDG grade, and a director general of health services. So there are two pathways after becoming a grade 1 medical officers. I'll tell you what are the requirements for the promotion, each of these promotional grades quickly. Intern medical officer, as I've told you, MBBS with provisional registration with Sri Lanka Medical Council. Preliminary grade medical officer, completed internship and full registration with the Sri Lanka Medical Council. That's why I told you the importance of maternity leave, because the preliminary grade date is the date with the where you get the full registration with the Sri Lanka Medical Council. So if the full registration with Sri Lanka Medical Council is getting delayed, your preliminary grade date will be also delayed, and that's why you will be junior in your batch when it comes to after the post-intern appointment. So to become a grade 2 medical officer, you have to pass the efficiency bar EBA exam, composed of E-code, accounts, hospital management, and language proficiency within 3 years of appointment, and you should have satisfactory services for 2 years after the internship. So this is when come to the disciplinary. If you have entangled with a disciplinary inquiry, you won't have a satisfactory services for 2 years, and you won't be promoted to grade 1 until your disciplinary inquiry is over, or if you get a punishment from the punishment date, you won't have a satisfactory services for 5 years. So it will be your grade promotions will be extended exorbitantly if you get entangled with a disciplinary inquiry. And one other important thing is you don't pass the EBA exam. So with the promotional grades, I want to highlight these points. Like obtaining maternity leave or extending the internship, you will be delayed in the preliminary grade. If you get entangled with a disciplinary inquiry, then your satisfactory service won't be there. You won't get the grade 2. If you don't pass the EBA exam, again you will not go to the grade 2 medical officer. Then grade 1 satisfactory services for 6 years from the grade 2 with postgraduate qualifications mentioned in the medical services minutes. 6 years after from your grade 2, have PG qualifications, it will be 12 years. So I'm not going to give you details about deputy admin, senior admin grade, and the specialist grade. those things are not material for the moment. So I just want to highlight the promotional grades in the medical officer period. Intern medical officer preliminary grade, grade 2 and grade 1. Then privileges at promotions, you will get salary increase, will increase in salary scale, overtime rates will be increased, you will get telecommunication allowance depending on your grade. After confirmation, I mean, I know that there are no vehicle permit now, but the vehicle permit you are entitled for vehicle permit, distress loans and research allowance. You go to the administrative gate, you will pay the administrative allowance, but no private practice is entitled. So issues related with the confirmation, as I've told you before, incomplete documentation in personal file. I'll tell you in next slide. Then initiating a disciplinary process or investigation or disciplinary order. So you won't get the satisfactory services for 5 years if you get a disciplinary order. If you get a punishment, you won't get satisfactory services for 5 years from the act of that commitment. So you won't get satisfactory services for 5 years. And throughout, until the disciplinary process is over, you will be considered as not having satisfactory services. So initiating a disciplinary process is one of the main important things. Then third one is not passing the EBA exam. So after your MBBS, I think EBA is the most important exam in your medical career, because I have seen some consultants who can't go to the medical specialist grade or the consultant grade because they haven't passed the EBA exam. So after your MBBS, EBA is the most important exam because of this reason. EBA exam you have to pass within 3 years of date of appointment. If not confirmed in the service, no increments to the salary after 2 years, not getting the pension, no vehicle permit or research allowance, less overtime rate, placed in lower positions in any transfer list, and there's a risk of premature retirement due to inefficiency. No one has gone up to now, I suppose, but even if you become a consultant, you won't get the consultant salary. That's the importance about EBA exam. Then personal file. It's the one of the main reason of the personal file. I've told you the one of the main reason for not issues in confirmation is the incomplete personal file. I'll tell you this, and there are 2 questions. If the consultant we are under suddenly leaves the country or transfers, are the interns forced to repeat? No. If the consultant is leaving the ward, then there will be another consultant who is cover up or looking after that ward. He will sign your internship. He should sign the. I don't know whether acting consultant can do that. I think, acting consultant can do that if consultant leaves. Yes. Is there any questions? Is O-level Sinhala requirement to apply? No, O-level Sinhala is a requirement for obtaining the language allowance. O-level Sinhala is not a part of EBA exam. If you want to get a language allowance, you need to have O-level Sinhala or O-level Tamil. This is an issue with the foreign graduates, I suppose. There is an issue. You have to settle it with the ministry and the people there, because some of the foreign graduates or some of the medical graduates who had not have their O-level in Sinhala or Tamil. If they done O-level in English, there is an issue in getting the language allowance. It is an issue for the language allowance, not for the EBA. I suppose. Yeah. Yeah. Any other questions? Yeah. So incomplete personal file. So these red color ones are the things you need to contribute when you need to contribute actively, because these cannot, even the subject clerk who is very efficient can't find this document in your personal file because he can't generate these. For example, birth certificate, educational certificate. At the duty reporting, you need to have duty medical report and affidavit to loyalty to the government and declaration of income. Those things. Then you have to actively get the WNOP number, marriage certificate and birth certificates of children, duty assuming letters from each station. These are which you should actively provide to the subject clerk who is conducting the personal file. If these letters are not there, then your personal file is considered as incomplete. That is the one reason of getting the issues of confirmation. For example, duty assuming of each station. Once you assume duty in a new station, you have to uh, sign in a book at the director's office, and at the same time you need to hand over a letter that you have assumed duties. That copy of that letter should go to the personal file of the Ministry of Health. So that is, you should actively give that document and make sure that that duty assuming letter is posted to the relevant central ministry personal file and other places. So those are the things that you should actively engage in providing for the personal file. And at the same time, the other thing is that there is a two personal files, main file at the Ministry of Health, depending on whether you are a consultant or a medical officer. It will be at tertiary care branch or EC branch or CB branch. If you are in the Ministry of Health, then it will be at CB branch, depending on the station. And there is a skeleton file at the working station. There are two personal files are there. Make sure that your duty assuming letters are kept in the both these main file and the skeleton file. And one other important thing, whatever the letters you are getting during your career, medical career, you should collect them and maintain a shadow personal file, because sometimes personal files get lost or the document get lost. It's a common incident. So make sure that you maintain a shadow personal file by yourself so that you can provide whatever the document you have to create a new personal file. So when you report it to duty in any station, make sure you make an endorsement in the duty reporting register or book kept at the office of the head of the institution. Make sure you submit a duty reporting letter. Make sure that head of institution send a letter to the main file and the skeleton file, and make sure skeleton file, leave and salary particulars, take a copy for yourself, are sent from the previous station. So make sure that at your skeleton file, leave and the salary particulars are sent from the previous station to the new station. Otherwise, your salary won't be getting for the particular month. So in order to pay the salary, the new institutions must have your leave and salary particulars. So make sure that you do that. Otherwise, you won't get the salary until the salary particulars and leave is sent to the new station. These are mainly for the once you completed your internship and during the post-intern transfers. So I'm going to have a brief break and brief knowledge check for you. I will put this to the chat box. I'll put this to the chat box and let's see how many of you can answer this one, answer this. And meanwhile, I will answer some of the questions until try to answer the questions I have posted here, whether I will answer the question. How many years of service need to get no pay leave? What's the rule and regulations on resignation from the duty? Can we sit the EBA exam following resignation? No. Oh, one thing is that how many years until you are confirmed in the service, you can't get no pay leave. Can't get no pay leave except for the maternal no pay leave. Meanwhile, other people, while listening to these questions and answers, try to fill the try to fill the questions in the link. Roshan, is link working? This link is working until I answer the questions. Okay, link is working. Then one other thing, yes. What is the other question? What's the rule and regulation or resignation of the duty? That is, you have to get the Ministry of Health impression on this. Resignation usually, once you give a letter to your head of the institution that you are resigning from the duty, you can resign, but it has to be processed. For the process, it may take, initially what you should do is, you should give a letter to the head of the institution you want to resign from the service. Then he will process that letter and they will see whether there are any loans or anything that you own from to the Ministry of Health. Then they will process the resignation. So that is how usually it will happen. Can we sit for the EBA exam following resignation? No, you can't sit for the EBA exam. Since you are no longer a government officer, you can't sit for the EBA exam. Language must be done in Sri Lanka. What? That's the issue. This your question. The O-level English, O-level Sinhala, O-level English, O-level Tamil is the recognizable thing for the language allowance. So it has to be done in Sri Lanka. There are some issues even at that time, but I wonder whether that is a are we allowed to wear scrubs? Yes, I suppose this dress code is it has to be endorsed by asked from the Ministry of Health. When the Ministry of Health people are there, since I am no longer a Ministry of Health employee, you should get the updated internship appointment letter. Try to get that. Maybe this year it might be changed. So do that. Yeah, going abroad after internship and coming back after some years yes, definitely you will be junior. You will be allocated to the post-intern list in the below in the lowest merit list. And before that, you have to get a Public Service Commission approval for rejoining to the government service. And if you get the government Public Service Commission PSC approval, then you will be placed in the bottom of the list. And you, with the next post-intern batch, you can get the appointment. That is how the previous procedure was. I wonder whether it has changed it or not. Then another question. How to inform in case of unplanned leave in the sense, I think medical leave. So you can inform over the phone to the responsible officer. At the same time, there are in hospitals, there are usually book to write telephone information, telephone messages of leave. So once that is recorded, that is okay. And then, but once you report it to the duty, you have to fill up formal leave application and give it to the office. You can inform via over the phone, or you can send a telegram. You can do that, but once you come back to the hospital, you must mention you must give a proper leave application and get it endorsed by your consultant and the director. Yeah, I have answer. I think, can we restart duty at some point after resignation? Yeah, the same thing is that the issue is, if you resign, then you have to come back, get the Public Service Commission approval to rejoin, and you will place at the bottom of the merit list in the next post-intern appointment. That is how it happened. Do interns get full registration at SLMC right after the completion of internship? No, you will get, requirement is soon after the completion, satisfactory completion of the internship, you are entitled to for full registration with the Sri Lanka Medical Council. But only thing that the process will take some time, but definitely you won't be penalized for that period. There may be certain administrative aspects that getting the certificate itself, but once you complete the internship, successfully complete the internship, you are entitled for full registration. No need to spend more time in the post-intern period. But it will take some time for the certificate to process. Other than that, there will be no. For doing foreign exam like PLABO, AMC, you don't need to resign. You can do it on a private basis. You can do PLABO, AMC, or whatever the thing. You can have, if you want to go abroad for to do the exam, and you can have your leave and go to the foreign country and do the exam. Other than that, you don't need to resign from the ministry to do the exam per se. You don't need to resign. You can do on your private as a private matter. Post-intern appointment, it's taught, there is nothing called post-intern appointment. That is until ministry is getting ready to provide you post-intern placements or appointments, post-intern placement, there is a certain period for that. But soon after you complete the internship, you are fully registered with the Sri Lanka Medical Council. Once you fully registered with the Sri Lanka Medical Council, you are getting your preliminary grade appointment. During this period, due to the arrangement, due to process things, there is a post-intern appointment. Ideally, it should be given as soon as you have to get it from the Ministry of Health. I don't know the current delay, but you have to get it. Get the time period you have to ask from the Ministry of Health, because I am no longer a Ministry of Health employee. Let's see what are your answers, since there are no questions. No, the other question, if we take leave to go for those foreign exam, do we get penalized for, or can we come back to original merit list? One thing, you can't get the foreign leave only 2 days foreign leave. I think you can get during until you get confirmed. So if you can complete your foreign exam within that period, you won't be penalized. Yes, you can come back and join the original merit list. You won't be penalized for, unless you resign or resign from the government service, you won't be penalized. Good character certificate can be asked. It's not a good character certificate, it's the good standing certificate. you have to get that information from Sri Lanka Medical Council when they will going to issue the good standing certificate. Usually, I think they are providing it for the doctor good standing certificate. That is for the requirement for offering medical registrations. Yes. I will show you the results of the your knowledge check. I hope you can see it now. This good standing certificate thing, you have to get it from the Sri Lanka Medical Council, whether they are issuing the good standard certificate as soon as the internship. I am actually don't know. Soon after the internship, yes, what is this? During the internship, is it possible to go out of the country on leave for medical purposes? That is case by case. You have to decide that. I can't out of this. If you are for a medical purposes, of course, yes, it will be allowed. For a medical purposes to go out of the country, definitely it will allow. But you have to decide it on case by case. This is a very special case, and for a medical purposes, it will be allowed. But it has to be a case by case basis. Yes. So the questions are: internship is a training attachment and the allowance is paid. Yes, it's true. Very good. But 39 people, it says false. So for the false people, please remember there's 39 people. Internship is a training attachment and this allowance is paid. Yes. Diary must be maintained during the internship. Yes. And only 4 people say that diary must not be maintained. That is wrong. So 4 people better not entangle with a disciplinary process, right? Intern can consume full period of maternity leave without losing her seniority. Yes, people are wrong. Could that 341 people gave a correct answer? The 58 people, you will lose your seniority at grade 2 promotion if you consume full maternity leave. So please be aware of that. Right? During internship, medical officer can engage in private practice. 402 people says no, yes, good. Only 3 people are expecting to do private practice during internship. Please be careful, right? Then during internship, every other weekend, leave can be taken without arranging cover up. For any leave, arrangement for cover up is a must. So 9 people, be careful. You can't take any leave without arranging cover up except for a medical leave. So good. Almost all the people have gave correct answers except for handful people who says that 43 people internship is not a training attachment, and 58 people you can consume full maternity leave without lose your seniority is also false. But majority have given correct answers. Very good. There is another question. Diaries provided by the ministry. Don't worry, you don't need to buy. Those diaries provided by the hospital office. Then I will go to the next slide presentation. Few things about, I might need to go quickly. I hope you can see the slides. Can you? So I
Can see, sir.
okay. I'm going to talk about few things that what administrators expect from an intern. Very few things on administrative perspective of internship. One thing, there are few take-home messages, very important things. Sort of market. Market is actually our customers, our patients. So treat them with empathy. Consider the quality and safety and kindness. Then diary, maintain your diary. Then time management is important. Consider doctor is a part of a team. You can't be isolated. Most of the people who entangle in stressful environment because you are not thinking about interprofessional relationship with other staff like nurses, uh, supportive staff, consultants, other doctors. So if you consider you are a part of a team, then most of the stressful things can be averted. Think about the rational prescribing and rational prescribing and ordering of investigation. Don't prescribe cocktail of investigations because of, especially considering the financial crisis now Sri Lanka is facing. Think about the rational prescribing and rational investigation and continuous professional development, which is very important. Think you should develop your competencies, you should develop your knowledge continuously throughout your career and maintain your competencies throughout your life. Then review your performance. Always ask what I have done wrong, what the thing that I have done mistake, and review your performance as always. Then cost of healthcare is important, especially in this kind of scenarios. Think about the cost of providing healthcare always, because these days it's very hard. I know that, to maintain the health system. Then medical documentation is very important to documentation. I'll give brief overview of those aspects in coming slides. There are a few questions also. Can I answer the questions later? Can see the questions. Yeah, the SLMC certificate, you need to, the specific SLMC things you need to ask from the SLMC, because it's a booklet version, but it will be provided to you. The certificate will be provided to specific details of SLMC. Please ask them, because things might have changed now. So rational prescribing and cost of healthcare. Although we are thinking that we are having a free services, free healthcare, the cost of drugs and consumable, who will bear the cost in free health? The cost of drugs, cost of consumable. In 2017, the this much of 38,595 million, that is 38.5 billion rupees was spent on medical supplies. Right? So what you can do, that especially antibiotics, continuously prescribing in the BHT without reviewing the thing. So daily review of drug chart is especially important as an intern. And ordering of it, during the ordering of investigation, please make sure that you are directed to the working diagnosis rather than prescribing cocktail of investigation, ordering cocktail of investigations and cocktail of drugs. So rational prescribing and rational investigations are especially important during these times. Especially think about the consumables, disposable gloves, sterile gloves. If you can use disposable gloves for a procedure, don't use sterile gloves because they are expensive. So those things are the cost of drugs. Maintain diary and time management. Maintain diary. I have mentioned you certain things about diary maintenance, but time management, I'll tell you certain things. Because you cannot manage time. What you can do is, what you must do is use your time efficiently and effectively. For that, you should make a plan, set priorities, and get organized. I'll show you the urgent, important matrix. Make a plan and make a set priorities and get organized during your internship. Avoid procrastination, that is continuously should not postpone your work. And at the same time, learn to say no at the same time. I'll show you the urgent important matrix in the next slide. So organize your work area, make a list of tasks for each day and prioritize this list. Keep a calendar handy at all times. Avoid time wasters. Sometimes there are many time wasters. Don't waste your time with time wasters. Do not wait until last minute and rush through a job. Complete it correctly at the first time. Set time aside each day to address all communication at once. Don't be afraid to ask for help. That is the most important thing during the internship. You are new to the setup. Don't be afraid to ask for help. There are heaps of, if you are having a good relationship, you will have heaps of friends in the ward. So you can ask from the help for there, because new environment, definitely you need to ask for the help. Then let's see what are the, how you can make urgent and important matrix. This is the urgent important matrix. You can divide your task into 4 areas. There are certain tasks urgent and important. There are certain tasks urgent and non-important. There are certain tasks not urgent, non-urgent but important. And there are non-urgent and non-important tasks. So if for the first one, urgent and important task, you have to do it for yourself. You have to do it for yourself. You can't do anything, because like attending emergencies, right? You have to do it for yourself. You can't delegate into it. If there is urgent but non-important tasks like emails, meetings, or get it, for example, if you want to get down an investigation from laboratory, investigation report from a laboratory, then you can ask supportive staff to give a call, or you can ask nursing staff to give a call, or supportive staff to go to the laboratory and collect these things. You don't know, it's urgent, but it's not required for you to do that task, particular task. So you can delegate it to, and that's why it's important to have cordial relationship, and that's why it is important to ask for help. So asking help and delegate the task is important for urgent but not important. For example, say that there is a patient who is going to for theater tomorrow, and some of his investigation report has not arrived. So you need to confirm whether he is fit for surgery. So you can ask one of supportive staff to go to the lab and collect the report, or you can ask one of the nurses to give a call to the laboratory and get the information for you. So that is, so you don't need to do it, but it is important that it is non-important, but for you to do the task, but it's an urgent thing you should do. So then there are certain things, non-urgent but important things, like meeting your spouse or girlfriend or boyfriend or your mother, father, parents. There are relationships. So you need to set aside a time for that. You need to have work-life balance. So all these things comes to the non-urgent. They are not urgent, but there are important things in your life. So to have a work-life balance, relationship, health, those things. So for that, you need to set aside a time for that. Then plan it and do not delay them, but plan them. For example, if you have a every other weekend on call, plan your every other weekend on call of weekend for these activities. Internship is a bit of a stressful period, but if you plan it, you can maintain the work-life balance very well. But better must adhere into mind, please, to avoid procrastination of those work-life balance activities. So plan them. And fourth one, time wasters like social media, teledrama, phone calls. There are heaps of non-urgent, non-important things. Limit them as possible. So this is how you can plan your time during the internship. And especially now you are using a lot of smartphones. use your smartphones to manage your time rather than consider it as a time waste. So, right, capture your commitments, arrange and prioritize your tasks, contact lists and grouping, calendars, reminders, document access. For example, you can store some of the guidelines in your phone itself. So you can easily access those document timers, alarms, picture captures, videos, WhatsApp. There may be a lot of WhatsApp group now among your consultant and other staff members for reading materials, audio recording. There are a lot of things you can use smartphone to manage your time. And social media, even with a clear purpose, you can use them. And for the work-life balance, some relaxation, fun, everything you can do it with your smartphone. Then medical documentation is another important thing during internship. Simply it is mentioned that if it is not recorded, it has not been done. This is a simple message on medical documentation. If you don't record it in the BHT or whatever the document, it is implied that it has not been done. So make sure whatever you do to patient, that it is recorded properly. So these are the heaps of things where you need to maintain the documentation, components of continuity of care, and components of trans of care. The continuity of care, first consultation, history examination management, ordering investigations, writing during the ward round, writing referrals, responding to a referral, medical notes at clinic setup, over the phone instructions. These are really important. If you speak to your consultant over the phone, as he has given some instructions, make record make record make record of those things, retrospective medical notes, diagnosis card. These are really important. Medical certificate, end of life decisions, confirming death. So these are the matters in relation to continuity of care. And then there are components of transfer of care, transfer between wards, ward and ICU, ward and OT, ward and radiology, special procedures between hospitals. So everything you should document it, because if it is not recorded, it is implied that it has not been done. So writing the date and time, very important when it comes to inquiries and investigations. This is the most important thing, writing the date and time. Writing and identifying the person. It is again important. Sometimes BHT, you don't know who has written this. So it's important for defend yourself. So if you do something and document it, make sure you have some identification in your to identify you as a person. Then abbreviation, very important. Don't use non-standard abbreviation. Recently, in an inquiry, I was involved in an inquiry where it is mentioned that chest X-ray FF, chest X-ray FF. So both our investigation team that this person has uh, put a chest X-ray and identified free fluid. So later during the investigation, we asked, even after you identified free fluids in the chest X-ray, why didn't you inform your consultant? In that intern medical officer told us it is not free fluid but foam filled. So don't use non-standard abbreviations. You're totally you can't justify the answer. It's a FF is free fluid for us, and for him FF means foam fill. So non-standard abbreviation don't use. Then at the end, correct diagnosis to the BHT, diagnosis card, medical certificates and death certificates are important component of health system. So make sure that you do those medical documentation very clearly. Then continuous professional development. This internship is a continuation of medical education, medical learning process of you. So think you are in a learning process during the internship, because you have an obligation to update your knowledge throughout your career through educational process, because knowledge from the basic training may outdate in the current context of rapidly changing environment. Rapidly changing because of epidemiology is changing, demography is changing. For example, epidemiology, there are more and more non-communicable diseases. Demography, there is more older people, less children. Social, technological transition, very important, rising patient expectation. You may have seen recently there are so much of smartphone videos. Ultimately, in Akuras or somewhere, uh, lady officer lost her job because of somebody's videoing and put into the social media. So be aware of these things. People, rising people patients expectations, technological transition. Within a matter of 1 minute, 1 second, you will be in the whole Facebook and people are scolding at you. So be very careful in this current environment due to rapidly changing environment. It's very important to update your knowledge as much as possible. And because you need to acquire knowledge and skills of the current basic practices through evidence-based healthcare. You should practice evidence-based healthcare as much as possible. So those are the importance of continuous professional development. Then doctor is, please consider doctor is a part of a team. Doctor is a part of the team. So if you consider that is a doctor is a part of a team, then many people will help you. That's the important thing. Many people will help you during the internship. That is really important to work in a stress-free environment during your internship. Right? So think about interprofessional collaboration, consider teamwork, change your values and beliefs and attitudes to suit your environment, working environment, because these are really important during your internship. You may need the help of a lot of people when you are working in that kind of still stressful environment. And consider importance of people in healthcare, because we in Ministry of Health has the second largest quantity among the civil departments in Sri Lanka. First is defense. It is not a civil department. After education, we have the largest quantity of human resources. But we are the first in complexity. We have almost close to 300 categories of health staff, from supportive staff, health assistant to the senior consultants. So diverse, complex people working in the healthcare. So teamwork, your values, beliefs, attitudes, everything is important. Especially if you, when you are becoming an intern, you must have support of all the other people. Otherwise, it will be a really hell of a environment if you don't have a interprofessional relationships and collaboration with them. Then quality and safety and review your performance. Again, I will give a brief chance to go for a quote. And before going to the quality and safety, I will put this to the chat box and answer some of the questions as well. The question is, are you satisfied with the current Sri Lankan health system? And I will answer some of the questions until you answer my question. There are a lot of there are two questions there. Somebody has questions, please put to the chat box. Meanwhile, you are answering this thing. I can't find the question. That's the reason. If you have questions, please answer that. I will share the screen of the responses. It's very interesting. Are you satisfied with the Sri Lanka? Almost half yes, half no. Roshan, do you wish to go out of Sri Lanka? Not yet decided. Maybe no. That's really good. Only 7.7% has decided to go out of Sri Lanka. Not, yeah, not yet decided, but it's increasing. It's now come to the 10%. Yeah, good. Most of you are satisfied with the Sri Lankan health system. That is also good. Yeah, I will just continue with this. You can continue to load the responses, but it's almost like 10% who wish to go out of Sri Lanka after the internship, like almost like 10%, and others are not yet decided is about 37%, maybe 28% definitely know about part of the people. Yeah, it's good. I just want to know before going to the next slide. I stop share this now when almost half people have. Let's see this one. You can continue to. So yeah, are you satisfied with our health system? Yeah. Some people say no, and some people say yes. Right? Why no? This is the reason. Government hospital is like that. Government school is like that. Government bus is like that. But government job is like that. So this is the general impression. But I want to ask who created this impression of government hospital. People themselves, people who are working in government hospital created this impression. Because sometimes we are not providing what people expected from us. We are not providing what people expecting from us. We'll see what people are expecting from us. But see what enormous work we are doing. According to the 2018 Annual Health Bulletin, total outpatient seen is about 57 million. That is double our population, more than double the population of Sri Lanka. How much work we have done? Total patient admission 7 million. Deliveries 300,000. Number of clinic visits 29 million. And we are Sri Lanka healthcare recent achievement: measles free, rubella free, malaria free, filariasis free, maternal neonatal tetanus free country. Then what do you call this? Mother to child TDH transmission is almost controlled. So we have done a lot of good things for our system. So why do it's like that? What do people expect? What do people expect? Then the service quality, responsiveness, communication, safety, so those things. Right? So you can remember when you get into a bus, people don't look at how good the tire quality, how good the brakes, but they will look at whether comfortable seats are there, whether AC is there. So that is having AC, having comfortable seats is the service quality. Good communication. If you want to go to private hospital, why people go to private hospital? Because of toilets and good communication. That's the lacking part of in our government hospital, service quality. If you can achieve the service quality for the people, technical quality for us, ours is the best. We have the best people, best qualified, best nurses, best qualified consultants, best people are with the government service. That is technical quality is our best. But what do people expect? These are the people things that we expect: service quality, responsiveness, and communication and safety. So try to provide them. Try to provide them. That's the main thing. Try to provide them. Then is it only us? No. This is US healthcare. In US healthcare, it is said that how dangerous. It is said that more dangerous than bungee jumping. You know what is bungee jumping? No, this one. This is the bungee jumping. It is said that in US healthcare in US is more dangerous than bungee jumping. See, even worse than driving, bungee jumping. So why? Is it not only for us? It is even in developed country, it's like that. So healthcare in even US is very dangerous. Assume that in 1998, almost 98,000 people died in United States because of preventable harm from healthcare. It's like crashing a jumbo jet every day. So visiting a hospital is similar to a crashing jumbo jet every day. So what we should do is that think that we always have to remember that healthcare is dangerous. Healthcare can be dangerous, and we must be prepared for patient safety. So that is the main thing you should realize. Right? Main thing you should realize. To avoid, there is a root cause analysis, quality and safety. I used to do this lecture for the last people, but I think you will get a separate lecture from Quality and Safety Directorate of Healthcare Quality and Safety. So from them, learn about quality and safety. I'm going to stop here for regarding the quality and safety. They will give much more detailed account of how to improve quality and safety. Just remember to improve patient safety in your career. You have a question, but I can't detect it. I don't know how. Yeah, I'll just go through the lectures. Then, yeah, even this one I won't be going because it will be done by quality and safety lectures. Even this one, these are some of the incidents that has been happened in Sri Lanka. Very famous incident, the loss of left arm of a law student from Colombo University. And in this incident, I'll show you the video, if possible, at the end. This mother has maternal death following twin pregnancy. And ultimately, this father left with two very small neonates without their mother. So I'll show you some videos on these at the end. Then wrong side surgeries. These are some of the incidents that has happened in Sri Lanka. Then I'll show you these videos after the presentation if I have time. At the same time, go through the Quality Secretariat lecture on quality and safety so that you can have some important insights on how to improve quality and safety in healthcare. So I'm not going to tell you about much details, but I will show you some videos later. Then I will go into the third section of my presentation or session, that is professionalism. I'll give you a brief account on professionalism, and after that I will show you the videos. Otherwise, but I'll try to get the video. Now we have talked to you about the quality and safety. It is better that we have the videos. Yeah, what I can do is I will show you uh, just wait a moment. I will give you another voting. Think about these scenarios until I play the videos, right? Think about these scenarios, two scenarios before I start the professionalism session. You have little time to read them, and then we discuss few things about the professionalism. Try to vote this one. Make sure that you vote for this one, and uh, while I play some videos for you regarding patient safety, read about the scenarios and uh, These are the responses. See then, to about 187 people have responded. I have few years back, these two incidents happened. Medical consultant drove her vehicle under the influence of alcohol and killed a policeman. Son of a politician drove his vehicle under the influence of alcohol and killed the policeman. Almost all the people mentioned that two incidents have same impact legally. Okay. Two incidents have same impact socially. Yes, mentioned by 78 and 139 mentioned no. Then two incident have same impact ethically. Yes and no. Two incident have same impact professionally. Yes, 62 and 164 years. Media can give more attention to the case of medical specialist. Yes. Son of politician. Yes. Media should give equal attention to both. Yes. Public should give equal attention. Media should. These are the responses. So I'm not going to comment about any of these. I just want to arouse your perception on these two incidents. There are no clear right or wrong answers to this kind of professionalism questions, but it's sort of for you to highlight these things. I have given you this thing, whatever the thing, it's good that you have answered and think about these kind of situations. I will just play one video because it's very difficult for me to, the maternal death video, I will play it out with the, we'll see whether I can show you certain things. It is not playing, we will go for. I'm really sorry, it's not working, it seems. It's not working. I'll just continue with my presentation, otherwise it will get delayed. Yeah. So you can see this, you have already answered this question while I'm trying to play the video. It's a little difficult. So this is the incident, two incidents that happened about few years back. I just want to have some concentrate your thoughts on these areas before I'm going into the professionalism. So before professionalism, I want to give you certain idea about a profession. What is a profession? A profession is a disciplined group of individuals, like in this case, we are gathered together by Sri Lanka Medical Association. So this is a sort of a disciplined group of individuals. One of the characteristics is profession. Adhere to ethical standards. This is the most important thing. There are certain ethical standards that govern to the profession, related to the profession. So ethics in this sense refers to the standards of human behavior, tell us how human beings ought to act in many ways that which they find themselves as friends, parents, children, citizens, business people, teachers, and professionals, and so on. I will give you one brief insight into this ethics or professionalism, there's one good idea, one key message when I heard a lecture from current Dean of the Faculty of Ragama Medical Faculty, Professor Madhava Chandratilaka. He is an expert in professionalism. He has mentioned that one key case study he has done in UK, he has mentioned that when he asked about a person regarding doctor's professionalism, that person in UK has mentioned like this: doctor can go to a pub and drink like with me, as me, but he should not come out from the pub like me or as me. So you can feel, that's why I put those two videos. The lady consultant or politico's son can go to a pub and drink as a politico's son, but whether that person should come out from that pub same as the politician's son. So that's think about that. So there are no right or wrong answers in ethics or professionalism. So think about those situations whether we can behave similar to a son of a politician. Son of a politician, we can behave as similar to that person. Those are thinking. For you to think you are going to be professionals in this country. Think about those situations because there are no clear or right or wrong answers. So we hold them out as unaccepted by the public. Public in the sense like Sri Lanka Medical Association. You are professionally recognized, professionally endorsed, and professionally accepted by the public through the Sri Lanka Medical Councils to practice medicine and surgery in Sri Lanka. So you are a special kind of people among our society. In these things, specialized education training you are having, special knowledge and skills, widely recognized body of learning derived from research, education and training at a higher level. Apply this knowledge and exercise these skills in interest of others. Like this. Our profession has evolved from Hippocrates' sage. There's a recognized body of learning in medicine and surgery, which derived from research, education, training from long over the years. So we are having a specialized training, specialized knowledge, skills that generated from over the years, shaped from over the years. So that's how become very similar. They are there are very similar. If you go to the characteristics of professions, you can see there are similar characteristics like law, then there are engineering, there are accountants. There are certain degree of common unique characteristics of those professions. Although they are may not be old as medicine or surgery, but there are certain degree of these characteristics. Then one other important thing, impartial, objective, counsel and service to others. We need to be impartial and without any subjectivity, we have to provide our services. These are the characteristics of profession. And direct and definite compensation wholly or apart from expectation of other business. We can claim some compensation, but it is not the pure business. For example, when you are treating COVID patient at that time, are we thinking about our families? We could have get the disease through the patient. Say carpenter, if a carpenter can say that I am not going to a COVID infected family, COVID infected house, I am not going there. But can a doctor or any other health professional say that I am not going to the COVID infected house or a COVID infected family? So it's impartial. What we are getting is not really a salary to risking our life. It's a compensation. That because of that, it's not a pure business gain as other people. Okay? So I took this from this Australian Council of Professions, but because of that, professions are occupations with special power and prestige. Special power and prestige. Okay? With that, the professionalism comes. The root of professionalism is the profession. what are with those characteristics. This is the definition. Professional competence is the habitual and judicious use of communication, knowledge, and technical skills, clinical reasoning, emotions, and values, reflection in daily practice for the benefit of the individual and community being served. So basically, these people ones I can get together and put as competency. So basically, professional competence is the habitual and judicious use of competencies for the benefit of the individual and community being served. So I'm just concentrating on this, what is this habitual and judicious, which is really important for when you are commencing your internship. So this habitual and judicious. As I've told you, at the root of professionalism is our profession. Our goal of our profession is to heal. And in a patient encounter, consider a right and good healing action for that patient. Right? To take two actions, right action, good healing action. Right healing action is one informed by the scientific and clinical evidence. And I'm very sure that you are so much of competent to take the right healing action that is informed by the scientific and clinical evidence, because you are just out of the medical faculty. So it's a habitual. You can practice every time you get a TB patient, you can learn, you can practice what you learn, and you can do it habitually, right healing action every time you practice, you can apply that knowledge. But good healing action is little different. In contrast, it takes into account patient values and preferences, which is consistent with the physician own clinical. Within our clinical judgment, you need to consider patient values and preferences for the good healing action. That is why the professionalism comes with judicious. This is the critical part during your internship. You need to take patient values and preferences and take good healing actions to be judicious. That is little critical. What you can't learn this at the medical school, right? That this is what you can't learn at the medical school. Ultimately, this is the professionalism. I am sure you are good at habitual decisions, but judicious decisions, it is not so. That's why medicine is a science and art. You have learned the medicine science, the habitual part, but the art you need to learn from your internship. You have to be judicious. That is when the judicious art, good healing action is important. For example, I will tell you this one. This is, say, TB patient with diabetes, TB patient without any complication, TB patient with pregnancy, TB patient with CRF, TB patient pregnant, TB patient with HIV. So, right healing action informed by the scientific and clinical evidence, you can take whatever the available in the guidelines, you can practice and apply to this patient. But consider this situation, the same patient, but to TB patient with diabetes who is disabled. You have to take a different sort of decisions depending on his patient values and preference. TB patient living alone, different set of things you need to apply. Pregnant TB patient without any income, you need to apply different decisions. You need to apply different sort of decision. Then TB patient pregnant with only primary education. TB patient with HIV who is living alone. So these are unique characteristics that you will meet during your internship. That's why good healing action takes into account patient values and preferences, and this is the most important part when it comes to treating real patients. You can learn it from the book, but when it comes to the real patient, these patients are totally unique to each other, totally different to each other, and this is the art of medicine, which you must learn, which you will learn during your internship. That is how the professionalism comes. Professionalism is not only taking right action, but it also taking good action, and that is when professionalism comes, right? So competencies, in order to do right and good actions, you need to have these competencies. Knowledge, skills are important, but more than that, values, attitudes, clinical reasoning, reflections, all things are very important, and they are relative to, as I've told you, relative to technology, relative to culture, relative to time, and everything is different to each other. And that's why patients are totally different, unique you will not get a same patient next time, the same patient next time, or even there are unique differences among patients. That is, you need to realize that is the most important part. And there is, for the competencies are continuously evolving and should be updated, and ultimately for the benefit of the community. That is another case of professionalism. The first thing, do your duty as a health professional. First, do no harm. Please don't. The patient safety, as I've told you, the patient safety is the most important. You must not harm a patient coming to your care. And you can cure sometimes, you can't always cure, but you can treat often and you can comfort always. These are the two main principles that you should practice during. You may not be able to cure everyone, but you can treat often, but you can comfort always. You can always comfort a patient, and don't do any harm for a patient. That is the main message I want to give you. So I'm not going to do a post-voting, but little things to remember. Even I can see that some of you, you will leave Sri Lanka. That is separate issue. But compare yourself with you after 5 years in future. How you came to the medical faculty now and in future. Think about the Facebook is a good source of information. How you came to the faculty, how are you now? Think about your growth, think about your recognition, think about what have you gained. So think about, just go through the past Facebook of you, and also after 5 years from now, look back at what has happened to you. Commercialization, there is ethical commercialization versus professionalism. You need to have money, but you can be commercialized, but it should be ethical commercialization and balance it with the professionalism. And migration, if you migrate, think about what you can do for your country, because migration is another option in this kind of scenario. You can migrate. I mean, it's your own wish, but even if you migrate, think about what you can do for your country. So pay gratitude, because from birth until you die, you are getting so many things from the society. Even at school, even when you are, before even you born, during your school, during your birth, you are getting a lot of things from the society. And for what you can do what you can pay your gratitude by working in a professional way. That's the only way you can pay the gratitude to the hospital, gratitude to the society. So enjoy your work. Internship is, you will not have any other internship in your life, once in a lifetime experience. You are molding into a professional. There will be a lot of fruitful learning experience through reflections. Treasure it with wonderful memories and enjoying it. All the best for all of you, and thank you. Do you have any questions? That is the end of my session. Do you have any questions? You can tell it to me. You can send any comments. And there's another final feedback. I just want to improve myself. So just send me your feedback through this form. Even if I go, you can send me few comments. Then I can improve myself for the next batch of interns. If you have any questions, I can answer for about 5 to 10 minutes. Roshan, hope that is okay now. No? I went a little fast at the end, but yeah, some of the SLMA things you need to ask from them, because I am not exactly familiar with the SLMC thing, and at the same time, the Ministry of Health things, there may be certain updates after I left the country. Prashant, shall we wind
Yes,
up?
sir. Okay, sir. Yes. Right. Thank you very much, sir, for the wonderful comprehensive lecture, in-depth description of health system in Sri Lanka. So thank you once again, Dr. Dilanda Ramavardhana, consultant administrator, medical administrator. Thank you, sir, for your time and
Prashant, keep
yes, sir.
for a little while, keep the this thing so that I can get a feedback from these doctors so that I can improve myself. Don't leave the thing, so otherwise they won't get the chance to give a feedback.
Okay, sir. Right. So tomorrow, thank you once again, sir. So tomorrow we have surgery session. So 1 second. Yes. Tomorrow we have surgery session, so make sure that you are joining by 7:45 tomorrow. So that's for tomorrow. So thank you once again, Dinanta sir, for delivering that wonderful lecture. So I will share this registration link. It will be activated for 5 minutes. Make sure that you all submit correct details. So, thank you, sir.
Then I will leave, Roshan. Thank you for the opportunity given, Roshan. Thank you.
So thank you for right, sir.